Now, eating disorders have been around for a long time, and unfortunately, many young Irish women and men fall victim to the pressure surrounding body image. But one new eating disorder is causing particular concern amongst nutritionists and psychologists alike. It has been named Drinkorexia, and it involves a dangerous mix of dieting and binge drinking. Here to tell us more about it is nutritionist Margot Brennan and psychologist Sascha Mayman. Good morning to you both, ladies.
Good morning.
Now, we were just talking about it in the break, and this, to me, is so alien. First of all, I'd be on the floor after a couple of glasses of wine if I hadn't had anything to drink. But this is something that you're actually experiencing, Margot, that girls are... Well, tell us about how you came to discover it, because this is fascinating.
Yeah, I mean, there was never, I suppose, a name on this before, but I got a call about 6 weeks ago from a local radio station who had received a letter in from a group of friends that were very concerned, in particular, about one girl that was part of their group, who come Thursday, Friday, saved up, she was doing the Weight Watchers programme, saved up all her points, and then drank it over the weekend. And, you know, obviously ended up extremely drunk, very unwell, etc. And they were very, very concerned about her. And that's really the first time that I saw it given a name as such. I mean, we're all aware, and it's not common, but it does happen where people occasionally go out inadvertently, maybe of a Friday evening and forgetting, and it
you
wasn't
get carried
planned.
away by the evening. This is
quite
planning.
different. This is very planned and very well planned in many, many cases.
Sascha, I mean, you were saying as well that in your experience, because I was kind of thinking, I don't know if this is a 30-something thing. I don't know whether we'd be organised enough.
Probably not.
Yeah, probably not. But you were saying it's more kind of 18 to 25s, yes. And particularly women. And
trying to fit in, trying to be cool. The whole binge drinking, going out on a Friday, Saturday night, and having to, you know, keep up with everybody. But at the same time, there's this whole pressure on, oh, I have to be thin. You know, I have to follow that cultural, you know, obsession of being thin and slim. So how do I fit them both together? And, yeah, as you were saying, while it has been around for some time, it's now become so common that people are actually putting a name to the whole thing.
And you're seeing this yourself?
Yes, I am, yes.
And the girls that you're seeing, it is mainly girls, you said.
Mainly, yes.
The girls that you're seeing with this, are they actually calculating, you know, well, if I don't eat lunch and dinner on Thursday and I just have a little bit on Friday, then I can have X amount of booze? Is it that calculated?
It is, and I mean that would be more the anorexic way of thinking, whereby there's also a few patients that I would say that are probably more suffering from the bulimic syndrome, and they would then just think, oh yeah, I can just make myself sick, purge the whole alcohol back up, then they lose count completely, and what they're really consuming is so much more that they really thought they were, and it's very, very dangerous physically.
Margot, well, let's talk about the dangers. Physical dangers, obviously there's psychological ramifications as well, we'll come back to those, but just how bad is it for your body to consume alcohol when you have no sustenance whatsoever, when you're starving yourself? Yeah,
I mean, it's very, very bad. First of all, women metabolize alcohol very, very differently to men. We have a lot more fat in our body, so alcohol isn't comfortable in fat, so it goes into our bloodstreams very, very quickly. Okay. And obviously, you know, you get drunk very quickly. Clearly, that has a lot of social issues as well as other things. But also, the enzyme that breaks down alcohol is much, much lower in women. So we metabolize it much, much slower, and it is toxin. I mean, alcohol is a toxin. We need to remember that. And if we're putting it very quickly into our liver in large quantities, that is certainly causing liver damage. Is just one aspect of it. The other aspect is this really is another fad diet. You know, in other words, when you're not eating, your body has to break something down, and quite often it's muscle. Muscle is the first kind of major fuel after when energy is used up. And if you start breaking down muscle, and you're doing this regularly, you don't know where it's coming from. So you don't know whether it's coming from your heart muscle, your lung muscle, and that has long-term complications. Obviously, things like osteoporosis, because your diet is very poorly balanced, iron deficiency, you know, there's a lot of alcohol uses a lot of vitamins, like B vitamins in particular, and that can lead to things like psychosis and other mental health problems. So there is huge, huge issues around this.
So that's the physical side of it. Actually, if we can go back to the mental side of it, and you said earlier on that girls feel under so much pressure to A, look thin and be thin, and then to also join in the festivities of the weekend. So there are two very conflicting things, and are we going to see more and more of this, or how is this going to resolve itself, or is it something we should really start paying attention to?
Well, I think the problem still, if you look at eating disorders as a whole, it has got to do with low self-esteem and poor body image. So whilst not everybody is affected by it, I think, you know, the root stems from how you feel about yourself, whether it be anorexia or bigorexia. I mean, there's men and women that are affected differently by an eating disorder. But it comes back to what the cultural norm is. You know, we're now expected to look thin and to look beautiful, and young females especially are suffering so much from eating disorders. I would say between 25 to 35% of the bulimic patients would have a comorbid disorder that is substance abuse, whether that be alcohol or drug abuse.
Really?
And the anorexics probably between 20 and 25%. Yeah.
Is that because, again, is that feeding into the low self-esteem?
It is, and I think partly because, I mean, say with alcohol, okay, it does make you lose your inhibitions, okay, but at the same time then it craves, you get the munchies. So if you are very aware of, I have to lose weight and I have to be thin, but now I feel like eating, you're very likely to develop bulimia because you feel like, oh yeah, I'll just eat it, and then you feel bad about yourself.
And then you purge it back up again.
And then you purge it back up. And then you lose track of count, how much did I actually consume, and the vicious circle begins, and it happens so quickly.
Margot, it must be possible for young women and all women to go out and have food and enjoy a drink and not be too concerned about piling on calories. So what's the best kind of food to have before a night out? And drink-wise, what drinks are lower in calories?
Well, I mean, the first point is you should never drink on an empty stomach. You always, and I suppose if it's just normal meal, really, if you're going out in the evening and it's part of your evening, you know, have your normal evening meal.
So no food is better than another?
No food is better in particular, no. It's just that important. I mean, alcohol lowers your blood sugar. So coming back to that point about, you know, traditionally we get the munchies with alcohol. So the whole psychological aspect must be extremely powerful to overcome, you know, the fact that your inhibitions are lowered due to alcohol firstly, but then the hunger sets in. So that's, you know, to actually resist and not eat at that stage is extremely, extremely strong. In terms of the alcohol, in terms of calories, a short with a low-calorie mixer has the lower calorie content, but it still has the full alcohol content. So, you know, that is something we need to be absolutely aware of. In many ways, shorts for people, at least you know what you're drinking, whereas often with wine, you know, depending where you are, some people are very generous in the pour a glass of wine. You can actually be taking a lot more in than you're actually aware of. Shorts, on the other hand, is a measured amount, but it is a very, very concentrated form of alcohol. And certainly, you know, more than 4 drinks, a woman is binge drinking. So 4 drinks is like 4 gin and tonics.
I think if women watching this were honest and they were out on Friday or Saturday night, every single one of us binge drinked. If it's over 4 drinks, that's the reality,
very
that we're a nation of binge drinkers. And we just aren't facing up to it. Sascha, from a psychological point of view, if people are watching this right now, or their mothers are watching it, or their sisters or their friends, and thinking, gosh, I'm doing that, or so-and-so's doing that, what should you do? What can people do to move away from this dangerous type of behaviour?
Well, first they have to be honest to themselves and say, well, is there an addiction happening? After all, an eating disorder is an addiction. It's a form of numbing pain, shutting out emotions, as is alcohol, you know, drinking too much. So to be honest to yourself first, and then say, well, what can I do about that? And talk to somebody. Again, you know, make sure that somebody knows about it, because in your own head, you know, you tend to sort of like justify things and, oh, it's not that bad, you know. Like,
it is bad.
But it is. It's very dangerous. I mean, it is one of those eating disorders that probably would be fatal if you were to continue that on a long-term basis.
Could be fatal if you continued it long-term. OK, well, we've had website details up. If you have any concerns at all, do get in touch. And not just for women, men as well. Ladies, thank you very much. It's interesting to talk about something that could be fatal, like you say, Sascha. Thank you very much, Margot. And Sascha, we're going to take a quick break. We'll be back with lots more after this break, so see you in a few minutes. That's so scary, that binge drinking and the drinkorexia, that women are starving themselves so they can go out on the tear and down loads of drinks.
It's incredible, isn't it?
It's really scary.
What do they say is the cause? It's just, I won't eat food because the calories in the drink will be enough.
Sascha was explaining that it's a combination of, it's particularly young girls, 18 to 25, they're desperate to be thin, but they also want to be out on the party scene, being seen to be enjoying their drinks. But they're savvy enough to know that booze has a lot of calories in it. So therefore, they're not eating on the Thursday, not eating on the Friday, and that's equaling, I don't know, 1,000 calories, and then they're allotting themselves that for the night's drinking out, which is causing even more liver damage, even more kidney damage and everything else.
And bringing it on that bit quicker.